The 5 ways to prevent the issue of chronic kidney disease is what we are going to discuss in this video. So you are going to learn about what are the 5 things you can do in order to prevent this issue. In my previous video, I talked about the 5 major causes of chronic kidney disease in our society because of the increasing rate of kidney disorder in our society. Number 1 way you can use to prevent chronic kidney disease is by exercising. I want you to understand that exercise is one of the ways that you can use to prevent this issue. Understand also that exercising is in 2 forms. 1 is aerobic exercise. Number 2 is anaerobic exercise. If you want to prevent chronic kidney disease, you must do what is called aerobic exercising. Something like jogging, something like playing ball, lawn tennis, swimming. These are forms of aerobic exercising. One thing you must understand is that when you exercise aerobically, you are also preventing hypertension, at the same time preventing diabetes. So these 2 things, which are the major causes of chronic kidney disease, will be treated or be prevented by exercising, especially aerobic exercising. Number 2 is water intake. You must not forget that as an adult, that 60% of your weight is made up of water. So you need to be taking plenty of water. Minimum of water that you take in a day as an adult is about 2,500 mils of water. That is 2.5 liters. So if you have something like this in a day, this is 750 mils. It means that you should take 4 of these in a day in order to be sure that you are actually taking water. That will help you to prevent chronic kidney disease. Another thing you have to also do is to reduce the amount of salt you're taking. Most of our people don't know that most of the food we are eating these days, they are processed food. And most processed food, they contain spices and they contain salt. Those spices are usually made up of salt. So you should ensure that you are reducing the amount of salt you're taking. I want to tell you that you can actually prepare food or meat or meals, even soup, without salt in it, because God in his infinite mercy has actually placed salt naturally in all the things we are eating. Rice has amount of salt that it contains. Even the vegetables we are taking, they have salt in them. So you don't actually need to put any salt in your food. Or even if you want to put, you should put more for a psychological effect. Otherwise, you don't need salt. The more you take salt, the more the chances of you having hypertension is increasing. Number 4 is to do what is called electrolyte urea creatinine. Do it at least 2 times in a year as an adult. That checks the level of your kidney function. That helps to know how functional is your kidney. So you should request, go to the hospital and tell them, please, can I check my kidney function? They will send it for the test. And from there, it will be calculated to know whether there is any problem that is affecting your kidney. The number 5th part of the thing that you can do to prevent chronic kidney disease is to treat the underlying conditions. For instance, if you have hypertension, treat yourself of hypertension. Ensure that you exercise and take your medications, the antihypertensive medications. Also, if you have something like diabetes, treat yourself of diabetes or take your drugs for diabetes, and at the same time exercise. When you are exercising, that will help to prevent all of this. So these are the 5 major ways you can use to prevent and treat chronic kidney disease. Please don't forget to help me to share this video so that it can get to as many people as much as possible. Thank you so much.